Shocking truth. America spends twice as much on healthcare as any other country, yet lives shorter lives. Why? Today we talk to a doctor who's seen both sides, practiced in Japan, and right here in the US. Doctor, welcome. Let's dive in. Just how extreme is the US healthcare cost problem right now in 2025, 2026 numbers? Give us the jaw-dropping stats compared to other rich nations.
In the United States, healthcare is by far the most expensive in the world. Latest figures show national health expenditures reached about $5.3 trillion in 2024, pushing per person spending to roughly $15,500. Projections for 2025 put total spending around $5.6 trillion, with per capita near $16,000 or more. As a share of the economy, it's hovering at 18% of GDP. Compare that to other wealthy countries. The OECD averages around $6,000, $7,000 per person. Even Switzerland, the next highest, spends about $10,000. Many European nations and Japan are half or less, often $6,000, $8,000. Japan, where I trained and practiced early in my career, spends far less per capita while achieving longer life expectancy and excellent outcomes for chronic conditions. The gap isn't small. Americans pay 2 to 2.5 times more than peers. Yet U.S. life expectancy lags, preventable deaths are higher, and many skip care due to cost. Two-thirds of Americans worry about affording care, with premiums jumping 10 to 20% or more in 2026 for many plans. This isn't efficiency. It's a system leaking money without better results.
What are the main reasons these costs exploded so high? Break down the biggest drivers. What are the main reasons these costs exploded so high? Break down the biggest drivers.
Several forces combined, but higher prices, not more care, are the core. In Japan and most peers, governments negotiate or set prices centrally. Here it's fragmented. Thousands of insurers, hospitals, and drug companies set prices with little restraint. First, administrative waste is massive, up to 30% of excess spending. Billing, prior authorizations, different rules per insurer. Doctors and hospitals employ armies of coders and clerks. In single-payer-like systems, this overhead is tiny. Second, prices for everything are inflated. Hospital stays, MRIs, surgeries cost 2 to 3 times more here. A hip replacement might run $30,000, $50,000 versus far less abroad. Physician fees, especially specialists, are higher due to market power and training debt. Third, prescription drugs dominate headlines. Brand name and specialty drugs, like GLP-1s for weight loss or cancer treatments, cost 2 to 4 times more. No broad price negotiation until recent limited Medicare changes. Pharmacy benefit managers add complexity, with rebates inflating list prices. Pharmacy spending surges drove much of 22.5-2286 increases. Fourth, consolidation kills competition. Hospitals merge, buy doctor practices, creating near monopolies in regions. Prices jump 20 to 50% post-merger. Vertical integration shifts care to expensive hospital settings. Finally, overuse of high-tech care, defensive medicine from lawsuits, and an aging population with chronic diseases add pressure. But prices and inefficiency explain most of the gap, not volume of care. Americans often get fewer doctor visits and shorter hospital stays than peers.
You mentioned prices. Why exactly are US prices so much higher than in Japan or Europe? What makes the same MRI or drug cost thousands more?
The difference is structural. In Japan, the government sets uniform fee schedules every 2 years, balancing innovation with affordability. Prices are transparent and controlled, Europe uses similar negotiation or regulation. In America, it's a private market with weak bargaining. Insurers negotiate individually, but big hospital systems hold leverage, especially after mergers. No single payer to demand lower rates. Transparency rules exist, but enforcement is spotty. Patients rarely shop effectively. For drugs, manufacturers launch at high prices, raise them annually. Patents protect monopolies longer here. Intermediaries profit from high list prices. In Japan, strict price controls and generics push costs down fast. Procedures reflect this. Same MRI machine, but U.S. facilities charge more due to overhead profit margins and lack of caps. Higher specialist salaries play a role. U.S. doctors earn more, but the main driver is unchecked pricing power. Fragmented payers can't push back like unified systems do.
Who or what bears most blame? Drug companies, hospitals, insurers, or the whole system? How do mergers and middlemen keep costs locked high?
No single villain. It's a misaligned ecosystem. Drug companies set sky high launch prices for new therapies, then raise them. Innovation is valuable, but without negotiation, profits soar while patients suffer. Hospitals drive much through consolidation. When systems dominate markets, they demand higher rates. Insurers pass them on. Acquiring practices shifts billing to expensive outpatient hospital codes. Insurers and pharmacy benefit managers negotiate discounts, but often benefit from high list prices via rebates. Employers, covering most workers, absorb hikes, then raise premiums or deductibles. The root: fragmentation prevents strong counterpower. Profit incentives everywhere. For-profit hospitals, device makers, PBMs push upward without enough regulation. In Japan, universal coverage and fee controls align incentives toward efficiency and access. Here, middlemen and monopolies thrive on opacity and complexity. Patients pay through premiums, deductibles, debt. Nearly half struggle to afford care. Outcomes don't match spending.
What does this mean for ordinary Americans today? And are there realistic fixes without killing innovation?
For families, it's painful. Premiums rose sharply in 22-6. ACA plans up 18 to 26% median. Employer plans 9 to 10% or more. Deductibles force skipping meds or checkups. Medical debt ruins lives. Many bankrupt from bills. Real fixes exist. Strengthen negotiation. Expand Medicare drug power system-wide. Enforce antitrust on mergers. Promote site-neutral payments so setting doesn't inflate costs. Cut admin waste. Standardize billing. Simplify insurance. Shift to value-based care rewarding outcomes over volume. Learn from Japan. Universal basics. Price discipline. Focus on prevention. America leads in breakthroughs. Redirect savings to access. Politically hard but unsustainable otherwise. Cost projected to keep rising 7 to 8% yearly, hitting 20% plus of GDP soon. Change requires viewing healthcare as public priority, not just market. Balance innovation with affordability. Possible, but demands courage.
Powerful insights. Thank you, Doctor. America's healthcare costs are a crisis hiding in plain sight. Share if this shocked you, and subscribe for more. Stay informed, stay healthy.